let's talk about, baby, let's talk about. Okay, this is not exactly the video that I was planning all along to make. I'm not here to show you my musical skills or artistic abilities here. This is not exactly what you think I'm going to be talking about today, but it's something that we most women experience right after explant surgery. So let's go ahead and talk about constipation. Yes, boo, I know it's not the greatest topic of the world, but it's something that is necessary to talk about. Just to kind of give you an idea, basically what happens is that your colon may be absorbing too much of the water from your poop, poop, which dries out in the stool, usually making it hard and consistency and difficulty to push out the body. This is a very, very common symptom that most women experience after surgery from anesthesia or from pain medications that you may be taking. So that's one of the reasons why I kind of stay away from pain medications because, you know, personal is my personal choice. Second is because I just know the side effects of that. So no. Anyways, a person also may have a constipation. It's something that if anyone doesn't experience constipation ever, I'm so happy for you. But if in case the times that you may experience, usually you may have like difficulty emptying the large bowel, and you may have a straining when you're pooping. You're probably having less stool than usual, and the stool is usually lumpy, dry, and hard. Just to kind of give you an idea of like how many times a day should you poop or what's normal. There's no such a like a specific number to say, okay, this is normal. You're the one that's going to know your routine pattern of your bowel movements, how you go to the bathroom every time. So you're the one that knows what's normal. I don't know if it makes any sense. The books may tell you something, but your reality it may be different, but it works for you. I don't know if it makes sense, but just have an idea of like usually they say in the books like 3 times a day to like 3 times a week, for example, is normal. So if anything, like for example, that you come across that your stools may have blood in it, or you may experience severe pain, or your constipation is lasting more or longer than 3 weeks, that's when you probably your PCP, your primary care provider, might like refer you to a gastroenterologist if you have like a repeated patterns of this. So something that the doctor, the specialist, will look into further, right? Or if you have any type of family history of colon cancer, for example, things like that, that may alert that specialist to, like I said, to look into further, also your primary care provider. So this is just a chart here to just kind of give you an idea more or less. In this case, the constipation is today's subject is, you know, also for changes in diet could happen, but also pain medication could be another reason. And okay, so this is not like a prettiest thing to show you, but like I said, this is super important. Um, So this is like a chart where you, I know this is what I tell my patients whenever they go to the bathroom. Remember, I used to work in the hospital and I used to treat a lot of patients coming out of surgeries, and this is something very, very common for me. So it's something for me to teach anyone. So I always say, you know, once you poop, we have to look back. Do not forget that, because it's interesting how you know that how a poop can tell you a lot of things. Exactly, it's true. It can tell you many things of what's happening in your body. So, like if you, for example, may have like a zipper, like kind of little balls like this, that's a very constipated person, or a slightly constipated person may look like this. This is, you know, you can read the rest. And the normal is usually a sausage shape with cracks in the surface. I know it's too specific details here, and then something that you don't want to hear about, but anyways, you just kind of have to go down the list here and kind of give you an idea where you at. This is inflammation. For some women that experience inflammation. So yeah. And let's not forget, not besides the shape, but we also have to remember of the color as well. So I have the note here, you know, changing stool color can also be from something you have ate or maybe drank. So in my case, I have noticed like whenever I like to drink my beet juice, for example, in your beet juice you may tend to have some kind of like a pinkish, some kind of like especially your urine is just like pink, right? So don't get alarmed on that area. You have to keep in mind of that too. But also you may have like some kind of pinkish deal going on in your, in your stool. So usually the normal is brown. The light colored one is due to lack of bile, pancreatic, and liver diseases. The yellow is due to the fat in stool, malformation issues. Green, a stool may be from excess bile, change in diet, and diarrhea. The green is bright. If it's a bright red, that's very alarming. You need to really contact your doctor. Is due to also the bleeding in lower GI tract, and also dark. If it's black or dark, it's bleeding on the upper GI. So something very, very serious you need to really look into closely, and really talk to your doctor where you at as well. So how to ensure that you about healthy bowels? How are you going to do your part to be able to continue in this good track, right? So just know that you can do all the different things here that I put down. So just want to also let you know, for example, um, I do personally have taking steps that this is the things that are more like general, but I will let you know in the next slide what things I do personally. But this is something that I want to express with you, tell you that, because this is something that is very, very important to keep in mind to do in order to have a healthy bowels. It's just in generally, it's like you need to eat enough fiber, right? So you should recommend a daily amount of fiber, like 25 grams for women and 38 grams for men. Under 50, women are over 50 should aim for 21 grams, while men are 50. I'm just going to give you more like a general information. Drink, obviously, plenty of water. A reasonable amount is 8 glasses, 64 ounces per day. It depends also of your height and weight. I believe your weight. I'm going to look into a better calculation for you, but it's recommended like at least that much. So probiotics also is another way to help store like a natural balance in your bacteria in the gut, which is super, super important. So I eat my yogurts. I like my Greek yogurt in that example. And I usually stick with that of what works for me, right? You have to choose what works for you. So another idea is magnesium hydroxide is also occasional. This is for occasional constipation. It is safe for most people, although doctors do not recommend it because if for people that may have a renal insufficiency, just make sure to know your medical history, obviously, before you decide at any track, or consult with your doctor if it's okay to go in that route as well. So it's like a type of laxative, basically. So you have to kind of go with what your medical history is. Also, lifestyle change is super, super important. Like if anybody smokes, make sure that you may look into seeking to ways to have a smoking cessation program in order to help you to reduce the amounts of cigarettes you're smoking per day, just that will lead to a healthier lifestyle as well, right? Also, a type of level of exercises that you may want to start or continue doing that will help you towards having a normal bowel. Also have to help yourself to find ways to cope with your anxiety, and to help control the person's bowels movements, right? So this is those are the ways that I can tell you that you need to keep in mind, but at the same time, you're the one that's going to choose at the end of the day what's best for you, what works for you. Now, everything I say may work for everybody. So just kind of have that an idea of what works, right, the best at the end of the day. So I also want to share something too. So if, for example, like I said, you should call the doctor if for any reason, like for other people that that didn't have any surgery or anything in this case. If it's something that's a new problem for you, you can definitely let them know that it's something that it's been happening. Like I haven't had a stool for continuous more than 3 weeks, for example, right? So that's something that you really have to tell the doctor what's a normal pattern for you. So if you, for example, like I said earlier, like if you may have like any like bloody like stools or something like it's not normal for you, that's something that you have to make sure to tell your doctor about that, because they will let you know how to ways to treat it, or best to have a certain labs that you may take, like your doctor can order types of tests and procedures, and like for example a blood or urine test that reveals signs of hypothyroidism. It can help the doctor to find out ways to rule out certain medical conditions that you may have that you didn't know you had. um, like hypothyroidism may cause constipation, for example, and it may be a colonoscopy. It could help to internal view of your colon with a scope that can help to find out more about what's the issue. So you know that colonoscopy is not really pleasant. So during this procedure, like a small sample of tissue, like maybe taken to test for cancer or other problems that, or any possible polyps that will be removed also. So yeah, you can have like further evaluation through, obviously, through your doctor. So this is my go-to foods that I usually eat, that has helped me pretty much since I was a little girl. This is what I've been introduced by my family. So I just like to share with you the powerful fruits right here. Papaya. It's incredible. It has amazing benefits. Also, some benefits for anybody, not just for seniors, but for anybody. I know the elderly clients, for example, that I've noticed that they do have um, a lot of problems with this area because they're less active. So that's what I recommend any of you for, to continue to be active, because that helps also for your bowel movements. So, it does help for your heart disease protection, it lowers cholesterol, it stresses reduction, it's better eye health, diabetes management, inflammation reduction, and digestive assistance also. So, like I said to you, it helps a great deal. It's a very potent fruit, and it has powerful anti-aging properties as well. So also, let's not forget the seeds. You may think, seeds, what? Yeah, it does protect from cancer. It has the ability to stop harmful cell growth, supports liver kidney, boosts detoxification, it fights harmful bacteria, and protects from infections. It contains a high amount of enzymes that kills parasites, and balance hormones, improve fertility, and relieve menstrual pain. It's awesome, awesome, awesome. Just not to forget about the seeds. You can blend it out. You can drink it. Just think that it's just good for your body, so you don't think about, oh my God. But just remember that the seeds you can just, if you just want to, I would just blend it all up. That's what I do. So, or eat it as other ways that you want. It says here you can eat papaya seeds as whole. Remember to chew well, blend them in the smoothies, or use papaya seed extract. Also, don't forget the papaya has a lot of different vitamins like A, C, E, and vitamins B complex, which is awesome, great benefits on that too. Also, let's not forget the prunes. I know most people don't like prunes. I was pretty much grew up with prunes. Don't think I've been pooping all over. No, no, no. It's not to say that I eat it all the time. I haven't eaten in my adulthood, but definitely when I was young. It's some regular fruit, that it was a normal culturally wise. So if you're not aware of prunes, it's very, very amazing way of basically it's like a laxative big time. So is like papaya. Papaya you can eat like a raw, eat it by like literally fresh, just cut it in cubes and just eat it like that in the morning. Or I drink my prune juice, which is, I have to be honest with you, the prune juice is super potent. I do give this to my patients when they're constipated. I pretty much warm it up. I give them to them before breakfast, and I'm not kidding you. 9 out of 10, they go to the bathroom. Like, it helps you. And I know because I take it personally. I sometimes warm it up. I sometimes just drink it like that with ice. I just drink it like a drink, but it does help you go to the bathroom. So it assists you from iron absorption. It's a good vitamin C source. It normalizes blood sugar, prevents overeating, lowers cholesterol, improves your bone health, protects intestines, disease protection. It's a natural laxative and also an antioxidant. So yeah, it has a lot of great benefits. This is the prune juice that I use, and it has many different types of minerals and vitamins, and it's just absolutely incredible. So yeah, this is my two go-to fruits that I do use not to say on the regular basis. Thank God I don't have problems in this area, but I do use, especially right after a surgery like that. This is my go-to products that I always stick with it every time. So yeah, I just want to let you know, thank you so much for taking the time to go over this video. I know it was not as pleasant. This is my Pinterest that if you're interested to look into further, and I put all the products I've used in EXPLANT. This is the produce that I use. This is the link that you can find it quickly, or just go into my Pinterest and check it out, everything I put there. This is one of the phrases I came up with to help my patients and also to help you to always think that you are the captain of your own health. You're the one that knows how to um, collect all this data, and after collecting all this data that you're presented with by the doctor giving all this data about your medical history, about ways to help you with what you're going through, the medications that you're taking, you're the one that ultimately is going to choose which route is best for you. So just remember, you're the captain, so you're the one that's going to decide which way you're going to turn as far as getting into the best possible way to healing. So I always recommend to always exercise your voice and what you feel, what your concerns about in your treatment, so there's no miscommunication at all in the treatment plan. Anyways, guys, girls, thank you so much for everything. I just want to also, pass this information along to your family. If anyone is suffering from constipation, just let them know what I said as far as the prune and the papayas, my go-to things that I definitely 100% can tell you it works. It works all the time. And thank you so much once again. Have a wonderful day, everybody. Thank you. Bye.